given the assignment on video editing, we decided to do an online class where we recorded the video. Since in our group we had different teaching subjects, we chose a topic on biology, which is adjustable to all of us. The group members are Nimrod, James, Eric, Sharon, Cherotich, and Paul. So, let me welcome Nimrod, who will be our teacher today.
Yeah, thank you very much, James. So before we dig much into the topic, I want us to understand the structure of the heart. So we are going to talk about different vessels. Yeah. So today let's talk about the different vessels that come out of the heart. Sometimes those can be confusing for students, and so I thought it might be a good time for us to talk about those today. The major vessels that leave your heart are gonna be arteries. So arteries go away from the heart, and we'll talk about a special case in just a second. But as a rule, the largest artery you have is the aorta, and the aorta comes out and the branches into three different branches: the brachiocephalic trunk, and the left common carotid artery, and the left subclavian artery, and all of those will supply your head and your arms. Then you are also have different arteries come along the surface of your heart. So the circumflex artery is the one that you'll probably have to know for your test. It is kind of goes in horizontally and branches, and then you have the right coronary artery, this major one that goes down the front, and the interest of the left anterior descending artery, the LAD artery. This is the widow maker. That is the one that you hear about often, that if you have a blockage, sometimes if you have a heart attack because of it blockage here, there is really not much they can do about it. So that one is super important. You'll probably have that on your test, but this is the left anterior descending arterial, or LAD. You have pulmonary arteries which leave your heart and go to your lungs to collect oxygen. You'll have the pulmonary trunk, and then it branches into the right and the left pulmonary artery. Remember when you are labeling those on your test that you pretend that you are just in a diagram? So this will be the right heart, as if you are lying on the table face up, and this will be the left side. So that's a common thing that my student always will get confused, the right and the left parts. Now, before we get on to the next level, I would like to know if someone has a question, because I had seen someone raise the hand. Is there anyone who has a question? That was Paul. It seems that no one has a question. Now, we are going to talk about the diseases now which affect the heart. And so here is the detailed overview of heart disease divided into categories to help cover the topic comprehensively. Now, the coronary artery disease is the first one that we are going to talk about today, and the definition of it is that it is a condition where the coronary arteries become narrowed or blocked, reducing blood flow to the heart muscle. So the causes are atherosclerosis, high cholesterol, hypertension, smoking, diabetes, and sedentary lifestyle. And the symptoms of this heart disease include the chest pain, which sometimes we call it angina, which is there is also the shortness of breath, and also there is an heart attack. Uh, then there is diagnosis. We have the stress test. We have the angiography. Now the treatment. I will tell my students that it is not a crime sometimes to take a walk, sometimes to visit the gym and see what's going on there, and sometimes to sit down and meditate, which can lower your stress. Now, lifestyle changes is the one of the step you can take to for treatment. Then there is medications, which includes you going to hospital. You get statins, you get beta blockers, you get antiplatelets, angioplasty, coronary artery bypass surgery. Now we're going out to the second one, which is the heart failure. Uh, Heart failure, the definition of heart failure is it is a condition where heart is unable to pump blood effectively. And I think we shall stop there, and next time we shall look at that. Thank you very much. Have a good time.